Well, in 2020, the flu season was almost non-existent with social distancing, masks, sheltering in place, but we're getting back to work and we're getting back to school. So what are the concerns for the flu season of 2021? Dr. Ernest Grant is the president of the American Nurses Association, and he is here to urge the flu shot. Good morning.
Good morning. Thank you for having me.
Can you give us a picture of where we were in 2020 and where we might be this year?
Yes, it was just as you stated. Everyone was doing all the right things that we have preached over the years to help mitigate the flu. You know, washing our hands frequently, wiping down surfaces, wearing a mask, waiting 6 feet apart or so. And as the country has begun to open up, we're seeing that people are not doing those things as frequently, or in some cases have stopped that altogether. So as a result of that, we are anticipating that this year's flu epidemic may be what we're actually naming a twin-demic, that being the flu epidemic, very high cases of the flu returning, and also the continuation of COVID-19 as well, which both of those together will wreak havoc not only on individuals, but also on the healthcare system.
Are there groups in our society who are more at risk?
Yes, there are. We know that anyone can catch the flu, but we also know that there are certain groups that are at increased risk for flu-related complications. People from some racial and ethnic backgrounds are at a higher risk of being hospitalized with the flu, or they may experience higher rates of severe flu-like illnesses, that being non-Hispanic blacks, non-Hispanic American Indian or Alaska Native, Hispanic and Latinx individuals. But we also need to include individuals aged 50 years of age and older, pregnant women, and people who may have chronic health conditions such as hypertension, diabetes, heart conditions. All those individuals are also at a very high risk for having complications from the flu.
Well, thank you for giving us that picture. I know there's some concern about getting the flu shot and maybe getting the vaccine or the booster at the same time. What's your advice?
Yes, according to the CDC, their latest guidelines is that you can get both the flu shot and the COVID-19 shot or booster at the same time. There is an exception for individuals who may have a suppressed immune system. They would need to check with their healthcare provider. In those cases, usually they want you to take one shot 1 week and then wait about 3 weeks and then get the other shot. But for most of us, we can get both shots at the same time.
And what age group do we begin flu shots?
The flu shot can begin as early as age 6 months, in consultation with a pediatrician, but it can start at that age all the way up through, well over 100, since we're having people live, well past 100 these days.
So it's important for everyone. Can you send our viewers to a website where they can get more information?
Absolutely. Your viewers can go to flushotfridays.com. Again, that's flushotfridays.com. Get all their questions answered. They can also, at that time, schedule an appointment with their local pharmacist or their local healthcare provider as well. And as an added value, the paperwork that they would need to fill out while at the pharmacist or the doctor's office, it's already at that site as well. So that will reduce the amount of waiting time that these individuals may have.
Dr. Ernest Grant, thank you so much for all of this vital information.